On September 10th, 2025, during a debate event at a university in Utah, Charlie Kirk was shot, taken to a hospital, and a few hours later, his death was announced. So let's understand exactly what happened there, and why even the fastest treatment in the world wouldn't have saved his life. We know that Charlie Kirk was shot on the left side of his neck, an area containing quite a few vital tissues, where injury can lead to death. The first is blood vessels. The carotid artery, both its common branch and its internal branch, carry oxygen-rich blood from the heart to the brain. The flow rate in these arteries is about a liter of blood per minute, which means that a lot of blood can be lost if they are injured, especially considering that the average person has about 5 liters of blood. Next to the carotid artery is also the jugular vein, both its internal and external branches, which carry blood from the brain back to the heart. A lot of blood flows through them as well, and injury to them is also life-threatening. There are also many smaller blood vessels located close to other structures, mainly the spine, and injury to them is also dangerous. Injury to such blood vessels is critical in itself, but when it comes to a gunshot wound, the situation is much more severe. A bullet traveling at such speed creates the cavitation effect, which is like a shockwave balloon that damages tissues not directly hit, and this brings us to the nervous system. In the neck, there are many nerves that connect our brain to the rest of the body, including the critical vagus nerve. Damage to these nerves can cause immediate paralysis of critical body systems. And there is a clear sign that this happened to Kirk, who immediately after the injury entered a decorticate posture, arms bent inward with clenched fists and straight legs. This is a condition that indicates severe brain damage. So in addition to fatal damage to blood vessels and nerves, in such a situation we can also expect injury to the esophagus, the airways, structural damage to the spinal column, and another important point that can be seen in such cases is hypovolemic shock, which is a dramatic drop in blood pressure due to blood loss. This leads to a decrease in blood and oxygen supply to vital tissues, and it is a life-threatening condition within minutes. The initial treatment he likely received on the spot was first of all an attempt to stop the bleeding while maintaining an open airway. Immediately afterward, he was taken to the hospital, where I assumed they performed emergency surgery to try to stop the bleeding and assess the nerve damage. As mentioned, they were unable to save him. My assessment is that even if he had been in such a condition right in the operating room with the doctors, he would not have survived. The damage was simply too great. A combined injury to blood vessels, nerves, and the spinal column, along with extensive bleeding and brain damage, makes such an injury impossible to save. I debated a lot about whether to explain this case from a medical perspective, and I ended up deciding to do it after running polls both on Twitter and Instagram. This demonstrated to us just how deadly such an injury is, even with the most modern medical resources available, regardless of any political stance.